Hello everyone! Welcome to RGB Live's first ever entirely English program. In this program, we will be connecting to people all around the globe and chatting with them briefly about what's happening in their locations. To start with, our first guest will be Rebecca from all the way Sweden. Hi Rebecca, greetings from Istanbul.
Hi.
Where are you right now?
I am in Glasgow, Scotland.
Nice. Well, since you're Swedish, I have a few questions to ask you. Are you available?
Absolutely.
Okay, thank you. So, Johan Carlson, head of Sweden's Public Health Agency, said the recommendations had helped reduce the spread of the virus to vulnerable groups. But he said there have been physical and mental health consequences for those groups. Given the duration of the pandemic, he added, it was unreasonable for them to continue carrying that burden. So what I'm going to ask of you is, the population of Sweden is 10 million. 19.8% of it consists of the elderly, which means 65 years of age or older. So, do you think it's right to reduce precautions against coronavirus of this age group? How will they be affected? What's your opinion?
I think it's a difficult question to answer because obviously there's good and bad things of restricting it or not. And I think the way Sweden has handled the pandemic the last couple of months has reduced the risk of spreading and carrying the virus. There's always a risk, but they have reduced it, which means that a lot of people have been exposed to the virus and a lot of people have antibodies. So in regards to whether it is safe for the elderly to come out of their shell again, I don't know, and I don't think anyone really knows. But I do think from a mental health perspective, I think it's a good thing. Specifically looking back to how it's been, I think if you were to do it, now is the right time. Having any group of people isolating for a longer period of time is not good for any mental health, no matter if you've had mental health problems before or not. So I think it's an opportunity that if we were to do this, I think now is the right time.
Since you mentioned mental health problems, I also have a question regarding that. So, since Sweden is very much paying attention to not harming the mental health of people, they have not implemented any curfew in Sweden. The government officials only recommended to stay in and work from home. Keep in mind the social distance and also not gather in places consisting more than 50 people. There are two sides to this. Some people are complaining that measurements are not enough because it has been said that people who have already been through this disease can get sick again. So maybe there should be more measurements. But also there's this side that mentions the same thing as just what you did, that it is also argued that measurements such as curfew can cause severe depression in a country that already has a history and suffers with this issue. So what exact measurements is Sweden taking at this moment, and which way is it going to? Like, to which direction are they headed to?
Right now, they are implementing a lot more restrictions than they have been in the past couple of months. I think because they're seeing some rise in cases in local areas, but in general, the cases are decreasing because a lot of people have been exposed to the virus. So right now, what they've done is, instead of before, if anyone in the family showed any symptoms, the rest of the family could go to work or school and that would be fine. Whereas now they have said that if one member of the family shows any symptoms, the whole family has to isolate, which I think is a good thing because it reduces the risk of spreading the virus. They have also decided that, as you said, all people over the age of 70 do not have to shield, so they can continue and follow the restrictions that the rest of the population are, which I think is a good thing in the sense of boosting their mental health and bringing back their independence. But they're still really not really doing any restrictions when it comes to the day-to-day life. There's no queuing in front of the supermarket. There's no one measuring, whereas like here in Glasgow in Scotland, for example, there's people outside the supermarkets counting how many people are in the store at the same time. They have barred off or blocked off the front door in the front of the public transports in order to increase the safety of the bus drivers, which I think are a good thing. And they've also recommended to only use public transport if it's definitely or absolutely necessary, the same as they are doing here in Glasgow, which I think is a good thing. They've also said, my mum is a nursery teacher, and they have new restrictions there where they have said that if any child shows any symptoms, they have to head home, and if the symptoms don't disappear within the first 24 hours, they have to stay at home for a week, and the whole family has to stay at home for a week. And I think that's a drastic measurement in compared to like how Sweden's been doing before, but I think it's a good thing trying to reduce and maintain the level of cases.
Great. Could you compare it more to Glasgow and how Scotland is taking measurements?
Absolutely. Here in Scotland, Glasgow, people are wearing masks. People are not wearing masks in Sweden. They are more aware, I would say, of social distancing and more prone to social distance, whereas in Sweden, some are, some aren't. Because it's always, the thing is, in Sweden, these measurements, these restrictions are kind of like a recommendation. They want everyone to follow them, but you won't get fined, you won't get in trouble if you don't. I think the Swedish government trusts their population a lot more for them to handle it, and it's everyone's responsibility rather than just the government's and the laws. And I think here it's the same, but it's kind of opposite. It's the same as in like the government wants us to obviously carry our own responsibility, but they're also more strict on making sure everyone's social distancing, making sure everyone's wearing masks. If you're not wearing a mask, you'll get fined. All of these things. Right now, there's a curfew here for restaurants and bars and cafes of 6 o'clock. There's no alcohol. You're not allowed to serve alcohol at the moment in order for Scotland to reduce its cases or slow the spread, I would say. So there is a big difference between the two countries. It's just a matter of what you think is right. And I think some things are right and better in one country, and some things are maybe not as good and could be improved in the other country. So I think it's interesting to definitely have both experiences of two different countries, seeing how they handle this pandemic.
Thank you, Rebecca, so much for joining us and sharing your opinions and views and knowledge with us.
Thank you.
See you next time.
See you. Bye.
Hello, Leyla, all the way from Istanbul. Where are you?
Hi, Ayla. I'm in Moscow. You can see Moscow City right beside me.
Yes, thank you so much for the view. I have a few questions, if you don't mind me asking.
Sure.
So I just was scrolling through the news and I saw that Russia released the first vaccine ever for COVID-19 called Sputnik V in August. And now I heard that they are releasing the Epivac Corona, correct me if I'm pronouncing it wrong, this November. I have also read that Russia is working on the third vaccine already. So what I want to ask you, because you're a medicine student yourself, how are the effects of the first vaccine? Is it accessible by everyone? Why is there a second and third? Can you please fill me up?
Yes, sure, it is accessible. Everyone can have it because now it's going through trials, through clinical trials, and you can just volunteer to get it. It's not officially registered yet. That's why you can't buy it like in the pharmacy and stuff. But you can get it in lots of hospitals. They can offer it to you. There are no signs of the infection after getting the vaccine, and there are no like feeling feverish or tightness in the chest like the other signs of infection. You just can have some body aches for first 2 days after getting the vaccine and some high temperatures. And that's all. That's what we hear from news and what doctors tell us. In August, Russia declared itself the first country to approve coronavirus vaccine. And sure, you know that there are 3 stages of clinical trials while checking it up. Well, the first one is about checking it on young people who don't have any chronic diseases and stuff, on healthy people. The second one went through health workers, journalists, and teachers. It went very well. Also, they started testing it on public figures and they said that it was fine. Now they're starting the third stage of clinical trial. they're going to test it on 40,000 people who will volunteer. And it doesn't matter what age group they will be, which diseases they have, it will be just volunteering. You can have it if you want it. Russian government gets a lot of criticism from European and different countries, but they reject all of the criticism by telling the vaccine is developed from already known substances and it can't cause any risks for health. That's true, because you can get infected. It's not based on the coronavirus cells and etc. Doctors also say that someone has to try it and someone has to do it, and they mean themselves most of all, because the vaccine will never be evaluated before the third stage will be finished. So people are just tired and they volunteer because they want to help the progress and they want to calm down and feel safe again. Well, they're just trying to weather the storm, and that's all.
Thank you. I have another question for you. So since you mentioned the continuing developments on finding the vaccine and actually getting a stop for this COVID, I want to ask you about Russian people. How is this process affecting them? The trying to, develop the perfect vaccine, people volunteering. How is the mental health of a Russian person right now?
In fact, mental health is a closed topic for Russians. It's a taboo, I can tell. It's not really popular in Russia to go to the therapist or to check their mental health. They are mostly living in the past, in the Soviet times. Then you just haven't got a right to think of your mental health. You just had to work and leave. So that's what they're doing now. They're just trying to live and to cope with stress in different ways they can. Of course, the younger people, they try to rely the world community and to be together and to carry for each other. They're just trying to be open-minded and to be safe. Wash their hands, care of the distances, stay home.
Wear a mask.
Yeah, sure. It's necessary now to wear a mask whenever you're not at home. But some places of entertainment like cinema, theaters, they're still open. You can visit them. You just have you have to keep the distance. There are a half less people everywhere. You can't enter any place whenever you want. You have to register for it. You have QR codes to enter places. And if somebody from this place this time will get infected, you have a notification and the right to go and check to have the test for the infection.
So people are being tracked despite everything being open.
Yeah, sure.
Okay. Thank you so much, Leyla, for sharing what's going on in Russia. I hope to see you soon again. Goodbye.
Bye.